Psychological evaluations of the bariatric patient. Jennifer Finnerty, clinical psychologist, psychcontinuinged.com. Obesity and its associated medical and psychological complications continue to be a significant problem. Therefore, there's an increasing demand for bariatric surgery. This demand is likely only to continue with recent research such as that linking bariatric surgery as a cure to conditions such as type 2 diabetes. However, while this is often seen as a quick fix, the bariatric surgery, the weight loss surgery is not. Weight loss surgery is considered by patients who have tried and failed other ways to achieve weight loss, and they see it as magic to lose weight. Weight loss surgery is the most invasive option for weight management and comes with a higher risk profile than non-surgical options. The mortality and morbidity rates of these types of surgery are significantly lower than in the past with recent surgical developments. However, there maintains complications risk factors such as dumping syndrome, nausea, and other medical problems. The role of the psychologist is as a key team member of the medical team, because this is a crucial role that's needed for the success for the weight loss surgery. Success of weight loss surgery is highly dependent on maintenance of behavioral and lifestyle changes. Therefore, the psychologist's role is especially important, as he or she is in a position to evaluate the behavioral and lifestyle changes and has access and the knowledge to utilize psychological assessments that enhance this process. The use of psychological assessments are key and needed, and we'll discuss that in a little bit. The weight loss evaluation is simply not an up or down vote to allow for the procedure. The surgeon's not going to consult psychology and say yay or nay, but rather our role is to evaluate the current needs and issues of the patient. What we're supposed to do is to ensure that the patient is the best possible candidate for surgery. This role is highlighted by some of the research in the field. For example, the Bariatric Outcomes and Longitudinal Database, or BOLD, is a study that assesses the mid and long-term outcomes of bariatric surgery. With an estimated 60,000 participants, this particular study is a clearinghouse of sorts that tracks bariatric surgery. Specific to this, and of particular note, is the fact that the exclusion criteria for folks to be involved in this longitudinal study is the exclusion criteria of negative psychological evaluation. This highlights the important role of psychology. So, the need for evaluation. We talked about that psychology is a key member and that success is highly dependent on the maintenance of behavioral and lifestyle changes by the patient. It's important to note that while the mortality rates are low, less than 1%, which is a significant improvement over the past several years, there still is a complication rate of an estimated of 10%. So let's just look at some average demographics of bariatric patients as demonstrated by the BOLD study. Now this isn't going to give us all the bariatric patients, but with the rate of 60,000 patients, that's a pretty good estimate. So generally the majority of people who have bariatric surgery range from age 19 to 65. Now there are bariatric surgery evaluations and things focusing on adolescents, and we're not going to be focusing on adolescent patients. But for the majority of ages 19 or 65, which is a pretty broad range. A lot of places won't do the surgery on folks over 65. Now, of the folks taking part in the BOLD study, and in general, 78.76% of these participants are women. So a majority of the patients are women. So we have 19 to 65 in age and predominantly women. The patients in the BOLD study are also predominantly Caucasian. Generally, folks who are receiving bariatric surgery, most are Caucasian. Other ethnic minorities include African Americans, which comprise of 10% of the population. Hispanics, Asians, and Native Americans made up the rest. And with regards to the type of procedure, while there's various types of gastric weight loss surgery, the procedures were generally gastric bypass or gastric banding. Now we won't be getting into the specific types of weight loss surgery in addition with regards to gastric bypass, gastric banding, or other types of surgeries. So, when we're doing a psychological evaluation, let's look at the components. What needs to go into the evaluation? There are several components to a bariatric surgery evaluation requiring expertise of a psychologist. The sources of information should be multifaceted and include a wide range. So we'll start with the psychological interview. This is the face-to-face interview that should allow the psychologist to gather all the needed information to make informed recommendations and formulate treatment recommendations. Specific structured interviewing tools, such as the bariatric bypass interview, is particularly helpful in conducting this type of interview. Psychological testing is also an integral part of this assessment process. Choosing and utilizing instruments from the variety of available instruments to augment the psychosocial and diagnostic interviews should be done with particular attention to the instruments that may have bariatric norms, and also the instruments that you're most familiar with that will give you the information you need. Also, a medical records review. This is going to produce a wealth of information. In addition to Axis 3 diagnoses, things like the history of medical issues, treatment and compliance issues, and medications can be discovered and confirmed. Medical records can contain basic but valuable information such as previous interventions for weight loss, appointment attendance, including canceling appointments, no-shows, as well as prescription records. This should include what was prescribed, what for, and how the medications are to be taken. In some settings, the frequency of medication refills is also available. The fourth component of the evaluation is collateral information, and when available, is helpful in the evaluation to identify such issues such as social and familial support, use of support, and coping styles. This can also assist in gauging information of it, such as how significant others view the process and the degree of support the patient can expect following the surgery. And we'll discuss each of these in detail. So let's look at the psychosocial interview. The psychosocial and diagnostic interview is going to be a major source of information in developing the pre- and post-surgery treatment recommendations. This interview should encompass several areas and go outside the normal parameters of a diagnostic interview. The 5 axes are important in determining recommendations, but this is only one part of the interview. So you want to do a full diagnostic assessment to see if the patient meets any criteria for the DSM-4 diagnoses. The psychosocial interview should go past the 5 axes as well. It should include issues and encompass things like weight loss and weight history and weight loss attempts, the patient's expectations regarding weight loss surgery, knowledge of the surgery, the procedure, recuperation process, social support, medical comorbidities, substance use or abuse. This should include nicotine and tobacco use, and information about the patient's level of activity, including formal exercise regimens, is important as well. Let's take the time to look at each of these. So the psychosocial interview, the weight and diet history. The weight history of a patient is especially important. It's especially important to investigate the impact of weight on overall functioning. Issues can include such as the age-weight problem started, the overall pattern of weight loss, and the overall pattern of weight gain. These are particularly important. Assess for dietary history, including diets and history of weight loss and gain. The number, type, and success of each diet should be included. Also, the length of time that weight loss was maintained. If the patient has a yo-yo diet and weight loss and gain and a significant problem maintaining weight loss, that's important information. Information such as triggers to weight gain and through the patient's history will aid to an understanding of the role of food and weight in the lifestyle of the patient. As weight loss surgery is the most invasive type of weight management option, should not be the first line treatment of obesity. That should be a red flag if someone walks in and says, I need to lose weight, and this is the first time I've considered it, and I'm thinking about bariatric surgery. Documentation of previous weight loss attempts is important not only to see what kind of behavioral changes the patient has made in the past, but this may be required for third-party payers. Specific diets should include an investigation of formalized diet plans, fad diets, commercially available programs, or even medically supervised treatments. Current eating habits are also important. Aspects such as eating out, portion control, and current methods of regulating dietary intake should be assessed. Who does the cooking in the house? Are there expectations about food consumption or family rules about eating? Utilizing tools such as measuring cups, food logs, and menus also provides information about lifestyle changes implemented that will be needed for success after surgery. What the patient's eating, how they're eating it, how they're preparing it is especially important. And this leads us to the next point on the weight and diet history, is eating pathology. An assessment about eating pathology should include aspects of binge eating. A diagnosis of binge eating disorder would not necessarily rule out the patient for bariatric surgery, but it should be accounted for in the recommendations. Often, binge eating behaviors do not resurface immediately or even several months after surgery. Due to physical limitations, often the patients will not have an urge to binge eat. A return to more normal eating for the patient several months to 1 to 2 years post-surgery is at the greater risk time for patients resuming binge eating habits. Issues can arise such as expectations of weight loss and stress management that contribute to a return of binge eating. So therefore, assessing for eating pathology is important. It's also important to note that binge eating isn't the only eating pathology to assess for. Issues such as anorexia and purging behaviors are also especially important. The psychosocial interview continues with assessing the patient's expectation of weight loss. The patient's expectation of weight loss can also provide valuable information. Is the surgery seen as a magic bullet and a cure for one's obesity? Does the patient have realistic expectation about the amount of weight that will be lost and over what period of time? Generally, weight loss surgery patients can expect to lose about 80% of their excess body weight. But granted, while there's some rapid weight loss post-surgery, one can expect a period of 18 to 20 months to achieve the expected weight loss. How is the patient conceptualizing the need for weight loss surgery? What do they say about the amount of weight they expect to lose, the period of time for this weight loss? Also of note is the understanding that patients can regain weight following bariatric surgery. As it's not a cure for obesity, patients should be assessed for issues such as expectations of returning to past behaviors once they've dropped desired weight. Knowledge about maintaining recommendations and or how to cheat the post-bariatric surgery is important. So if patients don't understand they can regain weight after surgery, or that they might not lose as much if they cheat, or with behaviors such as drinking milkshakes all day, or returning to eating habits, that's an important piece of information to know when you're assessing their expectations of weight loss. Because if their expectations are unrealistic, that's going to contribute to a negative outcome for surgery. So, what does the patient know about the surgery? That's the next area to assess in the psychosocial interview. The specific type of surgery will be a decision made with the patient and the surgeon. This should be a collaborative decision. As there is a variety of treatment options, patients may have some ideas or preference of the type of surgery they may request. Often this is based on self-study or consultation with others who have undergone the weight loss surgery, including friends or family members. It's not uncommon for patients to download information from the internet and walk into the office and say, this is the type of surgery I want and the reasons for which they want it. It's important to encourage the patient to consult the surgeon prior to deciding on what type of surgery they would like to pursue. Having your heart set on a specific surgery before you're going to meet the surgeon is not generally recommended. Regardless of the specific surgery has been agreed on and or scheduled, the amount of information the patient has about the surgery is important, not only due to informed consent issues, but this will contribute to the overall preparation and recuperation of the surgery. Often patients have done extensive research about the types of surgery and are knowledgeable in both technical and layman's terms. However, this is not needed. A general knowledge of the type of surgery is important. Patients can access information from a wide variety of sources. Assess for what the patient knows, how they came across this information, from sources such as the internet or education from the medical team, support groups, or people who have had the surgery themselves. Having some information is common and suggested, but do not expect the patient to be a medical expert. Information the patient should be expected to have includes the general procedure, included expected length of hospitalization. What's the patient's understanding of the preoperative preparation and immediate postoperative procedure? Does the patient have a general understanding of the diet to be maintained post-discharge? Patients will be expected to maintain a strict diet immediately following the procedure and for some time be limited to liquids only. Does the patient understand how long it's going to take to recuperate? Do they understand when they're going to be able to return to work, return to normal household duties? Do they understand they're not going to be able to engage in their daily and usual activity lifestyle for a while? Do they understand the possible complications and risks of this surgery? These are all points that we need to assess to make sure the patient really understands what's going on. This is important, as I said earlier, for informed consent. Ethically, we're required to obtain informed consent, and the patient needs to truly understand all of these points to give informed consent. So, the social support. This is especially important because it's a key to success for the bariatric surgery patient. Following the surgery, the patient will require a caregiver due to the physical limitations post-surgery. Once the recuperation process is over, the patient will require support to maintain these changes. Supportive friends and family members can be a significant asset, just as non-supportive people in their life can be a detriment. The entire household is affected by the bariatric surgery process. The significant lifestyles that are required prior and following the surgery may require families to restructure a relationship with food. Patients who have family members that understand these needs and support the patient is important. For example, are the support people helping the patient adhere to guidelines, helping them participate in new, healthier ways to prepare food, and appropriate portion control? This can be important. An example of this is when the entire household rallies around the patient. They start cooking differently, they start making changes, and this can help with significant others and family members aid in the motivation and support efforts. So when the household becomes involved and embraces changes, this helps and does not leave the changes solely to the bariatric patient. In contrast, friends and family can sabotage the process as well. This can look like encouragement to cheat on the guidelines. You don't need to worry about that. You can eat that today. Or constantly offering people food. At times, there can be outright hostility towards the patient efforts. The hostility or sabotage from significant others can be motivated by a variety of factors. For example, if there's concern by the significant other that once the bariatric patient does lose weight, they might be concerned that they will be more attractive to other people, including members of the opposite sex. Concerns about how that would impact their relationship can motivate the sabotage as well. Also, some people have significant personal beliefs regarding bariatric surgeries, and this can resort to the bariatric surgery patient being ostracized or criticized for their choice of using bariatric surgery as a weight loss. Assessment for social support should be included not only the availability of people to assist in recuperation, but the attitudes the patient has encountered. Is there significant other actively participating or supporting efforts? Does the patient have a support from people who have completed the surgery? Are they willing to and able to seek out people who have gone through this process? Whether it's a friend or someone who has had weight loss surgery or a formal support group, see if the patient has talked to somebody or is willing to talk to someone who has experienced this surgery. There's a multitude of resources for folks preparing for and following surgery. Often the medical center where the patient is involved will have a bariatric surgery weight loss support group and access to folks who can talk to people considering bariatric surgery. The next step in the psychosocial interview is the medical comorbidities. This is important to understand the presence of medical comorbidities. Comorbidity of other medical issues is important to assess. Having access to medical records can provide this information, in addition to that what's given to the patient. Has the patient discussed with medical providers the impact of weight loss surgery on the management of these medical conditions? For example, will the dose or route of administration of medications need to be changed following weight loss surgery due to absorption issues? With weight loss, the amount of medication needed for effective control of medical conditions may be reduced with the loss of weight. Assess for the impact of current medical comorbidities. How has the patient currently managed these illnesses? Are they consistent with maintaining medication compliance? Do they go to appointments regularly? What's the relationship with his or her providers? Get an understanding of how the patient utilizes medical support and resources and their general understanding of their role in managing their illness. Generally, you want to assess for illness representation and health-related quality of life. This will provide information such as where they think the problems are, how they got the illness, and what they need to do to control this. This is going to give you information such as their locus of control and willingness to manage appropriately. Do they look to the medical staff to cure them with little interventions on their own? Are they someone who wants to partner with their medical staff? Or is it something that they don't feel that really can be changed, so therefore they're just going to go through the motions? So, the psychosocial interview also has to include an evaluation of substance use and or abuse. Generally, you're going to assess for all types of substances. Alcohol and drugs are going to be important, but also things like caffeine and tobacco use are going to be important and often overlooked. Obviously, you want to assess for the substance and abuse diagnoses, make sure that the person is not alcohol or drug dependent, but also things such as how much caffeine the person's drinking per day, what's the source. Often examining the caffeine intake is important to see how folks cope. If they're drinking something like tea with less caffeine as opposed to energy drinks daily, that can be detrimental to the medical comorbidities. Also, tobacco. Most surgeons require that someone is tobacco-free for 6 months prior to surgery. Are they able to do this? Do they need to go through smoking cessation prior to the surgery? These are important to assess for current and past substance use, as it's going to play a significant role. Finally, for psychosocial interview, assess the activity level. Not necessarily the formal exercise routine, which is important, but kind of the daily activity level. What does the patient do? Do they in a sedentary job? Do they sit behind a computer all day? What's their daily activity level? Are they getting up? Are they walking? How is their day going? Also assess for formal exercise routine. When did they start this? Is it something that they just started yesterday before coming to see you? Or is it something they started and gradually increasing? How long have they maintained this routine? What's been the success of the routine? Also assess for the attitudes about activity and exercise. This is going to be related to the health-related quality of life. Do they feel their medical problems inhibit their ability to exercise? These are important aspects to assess. So, once we've gone through the psychosocial history, the next step is the psychological testing. Now, psychological testing should include a variety of measures. Obviously, we want measures of psychopathology, but we also want to look at psychosocial measures of health status, weight and lifestyle inventories, substance use or misuse testing, a brief cognitive assessment, and also information about locus of control. Now, all of these types of assessments are going to provide information or additional information on those areas assessed during the psychosocial interview. So let's look at psychological testing. Measures of psychopathology. The gold standards in the field are the MMPI-2 or the PAI. We all know that psychological testing is a key component to bariatric surgery, and the psychologist should use a variety of instruments to supplement the information gathered during the psychosocial interview and medical records review. As I said, the MMPI-2 and the PAI are suitable to assess psychopathology, but you might want to supplement with specific face-valid instruments, such as the Beck instruments. The BDI-2, the Beck Depression Inventory, and the Beck Anxiety Inventory can also provide good information. Also, it's important to note that research of the use of these instruments with the bariatric population is increasing. So let's look at psychosocial measures of health status. There are several that are available. Health-related instruments are useful in assessing issues related to health-related quality of life and can provide a multitude of information. The Milan Behavioral Medicine Diagnostic, or MBMD, is a tool that can be used, and it can discuss areas related to health-related quality of life. The Multidimensional Locus of Control, MHLC, also gives you information about the patient's locus of control. Who do they feel is in control of what happens to them? Are they someone that's internally focused, externally focused? This is especially good information that will help impact the overall recommendations. Also, the Short Form Health Survey, or SF-36, is going to give you information about health-related quality of life. Other instruments that may be especially helpful are things like the Drug Abuse Screening Test, or the DAST, or the Alcohol Use Disorder, the CORE, or the Audit-C. Drug and alcohol assessments, pretty face valid, but they're going to give you information that will augment your psychosocial interview. Psychological testing should also include weight and lifestyle inventories, such as the questionnaire on weight and eating patterns, the revised, that's a QEWP-R. Also, the weight and lifestyle inventory, the WALI, is going to give you significant information as well. These are going to give you information on things such as binge eating and the impact of weight on lifestyle. Some psychologists also like to do some brief cognitive capacities. Such things as the mini mental status exam can be used regularly. Other cognitive capacity instruments that people have used include the Shipley, the R-bands, the Cognistat, depending on what the need is. So, once you've completed the psychosocial interview, the psychological testing, a medical records review, and interviewed collateral sources for information, it's time to write the report. Now, the report needs to be, you need to know who your audience is for the report. It's the psychological evaluation to summarize your findings. The report is going to be summarize and describe your findings, but the medical team is going to make the ultimate decision on surgery. The recommendations in the report need to be basically, yes, the person's appropriate for surgery, no, not currently appropriate for surgery, and no, not appropriate for surgery. Basically, the report needs to be done, and consider your audience. Is this going to medical professionals? Often it's important to have a summary at the beginning and the end of the report, and to put your findings. You're going to put in and follow up what would be indicated for remediation. How do we get the patients who are not currently appropriate for surgery to be up in the yes, appropriate for surgery category? Remember that you're documenting your assessment that's derived from all of the information you've given. So put in the report specific requirements and recommendations, and don't assume anything about the surgery process that can be adapted to fit the patient. So, recommendations can be provided regardless of the type of recommendation. The overall goal is to help the patient be the most successful candidate possible. Remember, the psychologist's role is not to give an up or down vote, but to give the information needed for the medical team to make its decision. Therefore, recommendations are appropriate no matter the type of recommendation. Generally, recommendations can fall into three general categories. Behavioral. These are things such as the patient will need to demonstrate that they've initiated behavior change needed for successful surgery. Recommendations on specific behavioral change that the patients will need to initiate, increase, or continue. At the basic level, things like modifying diets with the consultation to nutritional services, food logs, dietary restrictions can be important. Behavioral recommendations can encompass things such as diet, activity, compliance with medical appointments, and overall recommendations. What are the behaviors you want to see in the patient to make sure they're the best possible candidate? Treatment recommendations. If the evaluation uncovers psychological problems, either treated, untreated, treatment recommendations should be included in this report. Items such as maintaining regular treatment compliance, initiating or continuing mental health treatment are key to ensuring mental health issues are not complicating factors in the success of bariatric surgery. Note that most mental health problems are not contraindicated for bariatric surgery with proper treatment and stabilization. Surprisingly, as mentioned before, binge eating disorders are not contraindicated. However, conditions that would interfere with a patient's ability to maintain self-care post-surgery, including severe depression resulting in the neglect of ADLs or suicidality, would. Also, psychotic disorders that are severe enough to interfere with reality testing is a contraindication. Personality disorders, including severe borderline personality disorder with non-suicidal self-interest behavior, should be met with specific treatment recommendations. Quitting smoking is another key treatment recommendation. Maintaining medication is another key treatment recommendation. Regardless of the situation, if there's treatment identified, make sure that these are included in the recommendation. The third category of recommendations is knowledge. What is the information that the patient needs to have that they do not already have to get through the bariatric surgery process? Recommendations about increasing the patient's level of knowledge and understanding, as well as specific details and information that is required for increasing the chances of successful surgery. Often candidates for bariatric surgery have completed their due diligence and have significant and extensive knowledge about the different types of weight loss surgery, outcomes, and post-operative requirements. However, it's rare that the patient will have every piece of information they needed, and occasionally a patient will have significantly limited information. Recommendations should include the needed knowledge lacked by the patient. This can include the specifics with regards to the type of weight loss surgery, including the procedure, recuperation time, risks, and benefits. Other knowledge gaps that were identified in the assessment can include the expected diet in the time period immediately following and up to a 2-year period following weight loss surgery. Issues such as the lack of magic bullet and the risk of regaining weight following weight loss surgery are also knowledge gaps that need to be addressed. Other recommendations include needs for support and how the support person will play a role. The recommendations that fall into these three categories will make the most of helping the patient become the best possible candidate for bariatric surgery. Recommendations can also include elements regarding support, activity level, and dietary changes. As we've discussed before, social support is a key to successful weight loss surgery. Recommendations for bariatric support groups, if the patient is not already involved in this type group, can be especially important. As previously said, most medical centers have a bariatric center that includes folks who are preparing to go through bariatric surgery and those folks who've gone through bariatric surgery. Other than support groups, the patients should have social support to aid in the success of pre- and post-surgery. Increasing social support can be a key to successful surgery. Recommendations about the planning and needed coverage of the role the patient needs to play may also be needed. So recommendations for social support can include things like patient developing a relationship with social support group, looking at the willingness of the patient to do so, information such as preparing family members or the support person, identifying the support person and preparing that support person to provide the needed support. Recommendations can include maintaining social support, developing social support, and informing social support members of what the role needs to be. For example, if a patient's used to doing all of the household chores and running the household while a significant other plays a minimal role, then it's important to note and important for the patient to set up a plan on how this is going to get done. This can be an example of a recommendation with regards to support. Activity level. Recommendations for activity level is going to be especially important, especially for folks with more of a sedentary lifestyle. Increases and maintenance of formal exercise routine can be included in the recommendations. The patient will need to consult with their medical providers to determine specific exercise routines based on physical limitations, but recommendations should include increasing, maintaining activity level. Dietary changes. Depending on where the patient is and where they're coming to you, dietary change recommendations can include what's already been previously discussed. Is the patient at the beginning of the process where they haven't conceptualized how they're going to change their diet? Is the patient been able to maintain and demonstrate weight loss? The patient who has demonstrated weight loss and has maintained this weight loss is especially important. Recommendations for these folks can include maintaining changes, continuing to use tools such as food logs, but generally overall focusing on the dietary changes they've made and how they can maintain these. So, for example, identifying the barriers with the patient and recommending how the barriers to maintaining the dietary changes, such things as holidays, celebrations, and providing recommendations of how to overcome those barriers will be especially important. The recommendations overall for the bariatric surgery report have to be very specific. Again, the role of the psychologist is to help the patient be the best possible candidate for bariatric surgery. What do they need to do to increase the chances of success? So, what are some contraindications for bariatric surgery? Generally, there are a few that would be suggestive of an unsuccessful candidate and therefore a contraindication. Remember, cognitive impairment is one of those. Is the patient able to understand and take care of themselves? Do they take part in their treatment? Do they have cognitive impairment that interferes with their ability to maintain their activities of daily living or the maintenance of self-care? Active psychosis that interferes with self-care is another contraindication. Does the individual have psychosis that is going to get in their way of their ability to follow treatment recommendations? The next contraindication is suicidal ideation or behavior. Obviously, if someone is at significant risk to harming themselves, then lifestyle changes are not likely. Lack of cooperation with providers. Earlier in the assessment, we decided if the patient cooperates and partners with their medical providers. A lack of cooperation with providers, problems with solely internal locus of control, and just an inability or unwilling to trust the providers is a significant contraindication. If the patient cannot collaborate with their providers and cooperate with the medical regimen that's set between the two, then the chances of success for bariatric surgery is significantly limited and therefore a contraindication. Does the patient have an inability to manage themselves, their care, whether it be due to some of the factors we've talked or just in general, whether it's an inability or unwillingness to manage yourself or care due to diagnoses such as depression? That's an important component. Does the person have a lack of support, including a support person to help them during the recuperation process? Do they live alone, have no friends, don't drive? These are generally items of social support that, when they're lacking, will significantly reduce the success of bariatric surgery. So it's important to note that while people can develop social support, they can live alone. They don't necessarily have to have a large family support system, but if they have absolutely no support and no one to help or to call in the event of emergency, that is a contraindication. And finally, does the person have an unstable living environment? Obviously, if someone's homeless, living in a homeless shelter, or has an inadequate environment in which to recuperate from major surgery, that would be a contraindication. Now again, all of these contraindications, there might be recommendations to remediate these contraindications. References. These are just a few references that may be especially helpful with regard to bariatric surgery evaluation. I point out especially the Mitchell and Dewan book in 2012, Psychological Assessment and Treatment of Bariatric Surgery Patients, which is a must read for anyone creating or conducting this type of evaluation. Also, the Bariatric Outcomes Longitudinal Study, the Clinical Trials Governance Specifier, is especially important. That's the bold study. In summary, the bariatric surgery process is an important process for the patient considering weight loss options. Due to its invasive nature, the success of the surgery is based on a multitude of lifestyle changes. The role of psychology is especially important as we can provide a different and distinct perspective from more common medical procedures. With the synthesis of information with regards to the psychosocial interview, psychological testing, medical records review, and collateral information gathering, we can provide to the medical team the specific information that's needed and the psychosocial impact on the functioning of the patient with regards to the success of the bariatric surgery. The psychologist should play the role of expert in these matters and provide to the medical team and the patient the specific areas and behaviors that need to be addressed for the greatest possibility of success with the patient. The bariatric psychologist sits in a position that allows the patient to partner with them and their medical team to understand completely the options, the roles, and the lifestyle changes that are going to be needed. The psychologist also has the role of being able to make sure the patient realizes that this is a lifetime lifestyle change, and that not a quick fix. The role of psychology is key to the bariatric surgery process.